Bismillah ar-Rahman ar-Rahim. This is Professor Abdussalam Yasin Taha from the College of Medicine, University of Suleimani, giving a talk on writing for medical journals. This lecture is published on my YouTube channel, and you can access the channel by visiting the website at the bottom of the slide. Disclosure. This presentation is based on an article of Dr. Ameen Abbas Ameen titled Writing for Medical Journals, published in Postgraduate Doctor Middle East, Volume 10, Issue 5. And I chose this easy-to-read paper from vast literature due to its clarity and comprehensiveness, which make it an excellent educational material. So let us present to you the author of this article. Dr. Ameen is a consultant neurosurgeon in London with 40 years experience in Iraq, Jordan, Qatar, and UK. He was graduated from Baghdad University with distinction MBCHB at 1970, requalified from Society of Apothecaries in London in 1978. He had an FRCS degree in general surgery from the Royal Colleges of Surgeons in England and Edinburgh at 1977, and completed higher neurosurgery training at the Central, Middlesex and Charing Cross Hospitals, London, with an FRCS in neurosurgery at 2007. He authored and co-authored more than 17 publications in neurosurgical journals, and he had operated on more than 1,400 war injured victims from the 8 years long Iraq-Iran war, described by his consultant Robin Illingworth as Ameen has probably the largest experience of anyone in the world of missile injuries of the brain. So Dr. Ameen starts his paper by saying, I do not set myself up as an authority in medical writing and may not be capable of writing fine English. I will simply express my own views, point the way for beginners to follow by giving hints and general guidelines, which I have found helpful in writing papers. Hence, this is a trial to smooth over some of the difficulties, hoping that people will agree with me and find this article useful. In the Middle East, as in most of the developing countries, little has been done to improve medical writing, as nowhere in our educational system are students taught how to write. Writing, like any other practical art, cannot be learned entirely from books or in the classroom, but requires experience. Writing is believed to be more beneficial for the author than the reader, as it widens one's understanding of any clinical condition. It can make boring subjects interesting, and writing establishes the personality. However well overseas doctors speak English, many of them find it difficult to write. The question, how you published anything, comes at that sticky point during an interview for a hospital appointment abroad, after the chairman has read most of the facts of your application form. Writing is nearly of importance in countries of the third world, as the procedure for appointment is quite different. The well-known rules for writing clear, correct English are: choose the correct word, prefer the single word, use the active rather than the passive voice, and use short, simple sentences. Write with nouns and verbs, and not with adjectives and adverbs. Good style implies the use of a language that expresses the writer's meaning clearly, is grammatically correct, and is appropriate to the subject matter. This depends on confidence, which improves with practice, and on a wide knowledge of the subject. Good style is recognized by the reader as easy reading. For many doctors, writing for medical journals is a tedious duty, but you have to get over it, as it is an important part of career development for the ambitious in medicine. The secret to successful writing is to have something to say it well, to follow the principles of scientific composition, and to choose the right journal for the article. In the following slides, the story of writing and publishing a paper is reviewed step by step. So, writing starts by literature review, index medicus versus online search. After you have decided, the first question to be answered is, what has been done before? So start looking at some papers that have already covered an aspect of the work you intend to study by going through the relevant journals that deal with your work. Next, consult the index medicus of the last 3 or 4 years to complete your list of previous works. The librarian or an expert colleague could help you make use of the index medicus if you are not familiar with it. So what is the index medicus? The index medicus is a printed book used since 1879 to index the medical journals. This index was very useful in medical care, education, and research. However, the use of index medicus declined slowly and nowadays completely replaced by online databases such as Medline, Embase, and others. The last issue of Index Medicus was released in 2004. The librarian. The librarian may be able to produce a few more key references or will get you copies of the articles you need either in the available journals or as photocopies from the Royal Society of Medicine or the British Library Lending Division. The National Library of Medicine in the USA also has a computer system of information retrieval based on the index medicus known as medlars. Well, nowadays, obtaining the references is very easy in the internet era. It is very easy to access the journals and to collect relevant articles to the subject that we want to study by using the internet. But what we have mentioned is mainly before the era of the internet. At that time, scholars used to depend on the index medicus, but nowadays the situation is much different. The advice and help from your expert colleagues is invaluable. They may know similar work going on elsewhere and may be able to suggest shortcuts or indicate the snags in a particular approach. The statistician. Next, find a statistician before you do any work that brings in figures. It is no good doing the work and then presenting a statistician with a mass of figures and asking him or her to work out the p-value and the chi-square if the results are not suitable for valid analysis. Now, are you ready for writing your paper? Well, you have to start by choosing the title. The title should catch the eye, be attractive, and be accurate in telling the aspects of the studied problem. That is the title to be informative and should be brief. The title page should include the author or authors' names, affiliations, the department where the research has been done, and addresses of the authors should be mentioned in the title page. The correspondent author, the one that will receive correspondence from the journal, should be identified, besides his contact information, such as the email, phone number, and postal address. Other information include the ORC ID, or SID. That is a unique number or code giving to researchers to help people reaching their publications. There is a good case for keeping the traditional IMRAD. IMRAD is an abbreviation. It stands for the Introduction, Materials and Methods, Results and Discussion, as a format of scientific style. Next to the title is to write the summary, or sometimes the abstract. So it's the summary and the abstract. The summary is usually written after the rest of the paper, although some journals begin their articles with the summary. Summaries should be a clear, crisp, and precise statement of the objective and main result or conclusion. Abstract is the same as a summary. It might be non-structured or structured. Structured abstract consists of subheadings such as background and aim, methodology, results, and conclusions. The length of the abstract is decided by the journal. Usually, the abstract of an original article is in the range of 200 to 250 words. Well, the abstract may be the only part read by the readers. Therefore, it should be well written and gives a brief yet comprehensive idea of the article. Keywords and introduction. Keywords: choose few to several words or statements from the title and abstract of your paper to come after the abstract, which facilitate the access of readers to your article via the internet search. The introduction should provide a very brief summary of the problem it is proposed to tackle. What the reader wants to know is the answer to Bradford Hill's question, why did you start? With a very short survey of the literature. Methodology and results. Materials and methods. This should aim mainly to answer the question, what did you do? When your article deals with patients, the heading should be changed into patients and methods. The details of the methodology should be given only if the methods are original. Otherwise, the source should be quoted. Results. This section answers the question, what did you get? They should be presented in logical order, chronologically, or in the order of the complexity of the test, but as many results as possible into tables. The numbers in the text should agree with those in the table. Tables: follow the instructions given by the journal you intend to send your article to. Tables should present facts in the clearest possible way. They should not repeat information that is already in the text. If your paper has only one table, you should not number it, and you should refer to it in the text as the table. Otherwise, each table should be numbered. Every table should be typed on a separate sheet and should have a title. Well, nowadays, the position of the tables within the article depends on the recommendations of the journal. Some journals ask to insert the tables within the text, while others, they prefer to mention the tables after the references, or they may be sent separately on or during the online submission process. Figures and photographs. Figures should be used sparingly and for a definite purpose. Most graphs and histograms can be better expressed as tables. The eyes of the patient should be blackened. If the face has to be shown, the consent of the patient should be obtained. Discussion. Discussion should include the replies to the questions, what answer did you get, and what does it mean anyway? This is done by discussing the findings in the light of other reports. Reference to the discussions made in articles dealing with similar subjects could be quite helpful. References, that is the last part of the paper. please go to my YouTube channel and watch my video lecture entitled Reference Management with and Without a Software for a good understanding of the subject, and that is the link to the video lecture. Now, when the paper or the article writing is finished, now we come to the process of submission of the paper. So how to present your article? Before submitting an article to a journal, ask yourself, have I something worthwhile to report? To what audience is this addressed? Have I made my points understandable? Is it enjoyable, or at least readable, as well as instructive? And you must send the article to one journal at a time. Unfortunately, the situation with many journals in the Middle East makes it quite tempting to send the article to more than one journal at a time, as many of the journals are published irregularly and often stop for an indefinite period. Many of the journals do not even send an acknowledgement upon receiving the article, which may be found, the article may be found published a year or so later. Anyway, the rule is not to send the article to more than one journal at a time. Every article should be accompanied by a letter to the editor or a cover letter, even if you are a personal friend and have told the editor about your paper. Now, the choice of the journal, which journal our paper is to be submitted. This depends on several factors. Number one, the general quality of your paper or the article and the prestige of the journal in which you intend to publish. Number two, will the paper be of interest generally, or is it intended for the specialist reader? In other words, who do you desire to reach? Number three, is the speed of publication important to you? Well, with weekly journals, it is usually quick, while specialist journals may take over 1 year. With some journals, you could have an idea by looking at the date of submission as a footnote to each published paper. The Directory of Publishing Opportunities provides detailed address information, circulation rates, frequency of publication, and manuscript information, as well as average time required for an editorial decision and for publication of accepted manuscripts. Nowadays, the journal's metrics are displayed in the website of each journal so that you can have a full idea about the journal in question. Accepted or rejected papers. If your article is accepted, this, I believe, a great achievement, especially for the first article. Mostly, the editors ask you to modify the paper in some way, to shorten it, or to add something. If you think the referee or the reviewers have misunderstood you, this is your fault because you haven't made yourself clear enough. If you think they are wrong, ask some colleagues for their opinion. So what to do if your article is rejected? It is natural to be depressed, but common reasons for paper rejection include unnecessary and/or excessive length of the paper, repetition, poor flow of ideas, careless inconsistency among tables, figures, and text. So read the editor's letter carefully. Is it a polite rejection or a sincere suggestion that you try another type of journal? Is a referee's report giving you a clue to the reasons for the rejection enclosed? If not, you may ask for it. After rejection. Otherwise, go through the article carefully again, considering the points discussed before. Is the article original, scientifically, statistically, and ethically sound? Is it too long? Are the summary, introduction, and discussion absolutely clear? Is it well printed and conforms the journal's format? Helpful, experienced colleagues. If you still do not know the reason why your paper was rejected, ask one or two friends for their frank views. Choose ones with a wide experience of successful publications. So go on trying if you believe that the article is a good one. Well, in my case, I have found Dr. Salam Najib Asfar, a professor of anesthesiology, born at 1956. He works in College of Medicine, University of Basra, and he was the editor of Basra Journal of Surgery from the beginning, 1995 till 2020. I found my friend Dr. Salam Najib Asfar very helpful, and I remember many times, especially at the beginning of my publication, I took his opinion, and even he helped me in printing some of my papers when I was very poor in using the word processor. So we should mention that because experienced colleagues could be very helpful. Inevitable rejections. Editors reject badly prepared manuscripts and attempts to improve those accepted so that a journal may retain its high standards. Editors are often asked how they select an article for publication from the vast numbers of papers submitted to them. Half the papers can be rejected after a few minutes study because they fall in one of the following categories. Number one, review articles. Example of a review article: clinical features, pathological findings, and management of carcinoma of the rectum. Such a review article is adequately described in several textbooks, so they could be easily rejected by journals. Number two, hypothesis. If you believe strongly that your idea or your hypothesis is sound, then the logical conclusion is to find some data supporting or proving your hypothesis by a well-designed experiment. Number three, retrospective surveys. especially in our circumstances. Retrospective surveys are often unsuccessful. Old case notes of patients are not likely to prove something significant, as the hospital records cannot be expected to be complete. So the take-home messages of our presentation and the article of Dr. Ameen: remember that all medical authors have received letters of rejection. Such letters of rejection should be considered as constructive and should be followed by a trial to improve your skills in writing. While there is no certain way to ensure acceptance of your paper, the chance of rejection will be reduced if you follow the simple guidelines in this article. And don't forget the uh, favor and the help of our distinct expert teachers. In my case, I should mention with proud that I was one day a student of Professor Nazar Baqir al-Hassani, born at 1938. He's the father of thoracic surgery in Iraq, and I learned him a lot, particularly in the field of publishing. He was the chairman of the Iraqi Scientific Council of Thoracic and Cardiovascular Surgery for many years, and he has a large number of publications. He was my supervisor in preparing my thesis entitled Pulmonary Heart Assist, and I have the honor that I have one paper co-authored with him about heart disease of the lung. And also, I mention with pride my teacher, Professor Hamid Al-Ani, born at 1938. He's a consultant cardiothoracic and vascular surgeon, and I learned from him a lot, not only in the clinical field, but also in the medical writing process. And I should mention also with pride Professor Imad al-Mashat, born at 1949, consultant cardiothoracic and vascular surgeon, my lovely teacher. He was the former chairman of the Iraqi Scientific Council of Thoracic and Cardiovascular Surgery, and I learned a lot from him while supervising the thesis of board students and while reviewing some papers submitted to Iraqi journals. And also, I mention with pride Professor Majid Hamid Alwan, born at 1943. He is a consultant general and gastrointestinal surgeon, now settled in New Zealand. He's a well-known international figure in the field of gastroenterology. He has published more than 93 papers. I used to send my papers to him to be edited before submission to journals, and I have learned a lot from him, and I ask God to give him the health and the success in his life. And finally, Don't believe people who tell you that writing is easy. Well, this is Professor Abdussalam Yassin Taha signing off from the College of Medicine, University of Suleimani. We thank you for your patience and for listening and watching this lecture.